Hello and a very good evening to you. You're watching News 9 Digital. Thank you for joining me live. I'm Pratibha. The Ayush Ministry finds itself in the eye of a storm quite often. Recently, it was in controversy for the distribution of Ayush medicines for coronavirus, though it was not scientifically proven. That was in Uttar Pradesh. Apart from this as well, many have questioned the very existence of Ayush Ministry, in fact, because of the long-standing debate over alternate medicine and English medicine. But now, Ayush Ministry or the Ayush Department finds itself in soup over a report that has been filed by the Comptroller and Auditor General on the health sector. Now, this report has found a serious lack of initiatives on part of the Health and Family Welfare Department to streamline the operations of the Ayush Ministry and departments across the country. Now, several issues have also been mentioned in the report. It includes a complete absence of research, the underutilization of allocated funds that have been, any funds that have been allocated to the Ayush Ministry, non-completion of projects that have been approved even way back in 2015. There has been a mention in the report of the shortage of qualified professionals as well as teaching staff as well. Apart from that, substandard quality of curriculum, poor quality of Ayush drugs as well. Not just that, the report also mentions the Food and Drug Control Administration's failure in conducting proper quality checks as well as a lack in following appropriate treatment protocol that needs to be followed. Now, at a time when the country is speaking about mental health, the report has also made a mention of the same and says that there are not enough mental health care initiatives that are taken by the Ayush Ministry, with absence of psychiatric wards as well as absence of stock of medicines. These are some serious concerns, especially in times like these, in the times that we live in. In the beginning itself, of course, when the Ayush Ministry was created as well, there were several questions that were asked on why to mainstream alternate medicine in the first place. There were several questions that were raised, but it was said it was for transparency, but that has not happened. And this CAG report is a serious eye-opener because Ayush Ministry has to explain the kind of lack that has been spoken of in this report. To discuss more on this, Dr. Mohammad Rafi Hakim, the District Ayush Officer of Bengaluru Urban as well as Rural Districts from the Ayush Department, joins us. Dr. Mohammad Rafi Hakim, many thanks for joining us live. You know, the very purpose of mainstreaming Ayush was to ensure audit and a lot of transparency as well. But this CAG report is quite startling. Would you say, that this is the scenario in the Ayush Ministry and the departments across the country?
No, madam. This report is especially for Gujarat state as such. But in Karnataka, we have most of all the programs of the National Ayush Mission. They are implemented.
Okay.
As far as our department, Ayush department is concerned. Because earlier from 2015, before earlier also, Government of India given this more than 65 upgraded hospitals in Ayush. They are all upgraded. All projects have been implemented. All recruitment has been done. And after that, National Ayush, when National Ayush Mission's funds are given to the Karnataka state, here also we are utilizing almost majority of the funds. That is, we are in Karnataka nearly 100 health and well Pradhan Mantri Arogya Yojana. We are using this 100. We are upgrading 100 health and wellness centers in Ayush dispensaries, Ayurveda dispensaries, where the integrated treatment at the rural level is going to be taken place.
Okay. In this report that has been filed, like you mentioned, it's in Gujarat and it speaks of, funds being available but not being utilized. Like in this case, about 2 crore had been designated for the Ayush Ministry, but despite that, only about 43 lakhs had been used. This raises questions on, so it's not a problem of availability of funds. The program was not implemented in the state. There are various factors. That was the case in Gujarat. But I'm sure, some of the challenges that the Ayush department is facing in Gujarat, and they said it's because there's a lack of professionals, the availability of same as well. So do you as well face such challenges in Karnataka, and is that a challenge that the Ayush departments are facing across the country?
No, madam. In Karnataka, we are utilizing the maximum funds allotted by the NAM, that is the Government of India, in the various schemes it is giving for example, school health programs. It has allotted. We completed 100%. We reached 100% target. Okay. And health camps, the target has given to in Karnataka. We have reached 100% in health camps for the public. Ayush health camps for the public. And in similar way, this is what I have earlier mentioned regarding 100 health and wellness centers. They are also operationalizing from this year. That is, last year the allocation was there, and all the things are going on. All activities are taken place from the past. Because of the COVID, 3-4 months it has held, but it is restarted all the activities right now.
Okay. Also, Doctor, can you tell us how often do these audits happen? And, in the report it mentions that there's a lack of initiative from the Ayush departments and from the Union Health Ministry as well in ensuring that things are going on well in the Ayush department. So how often do these audits happen to ensure that everything is functioning well and any requirements, if any, are taken care of?
Audits are going to play, CAG audits are regularly, it is in regular frequency, they are going to taking place.
Okay.
But the funds given by the government of India, the utilization for the proper action plan, because we submit every year action plan, state action plan according to the funds allocation. Based on that action plans, PIP, then based on that PIP only, we are going to implement the program with their available human resource and the infrastructures.
Okay. Okay. Also, Doctor, in terms of infrastructure as well, would you say it's all in place in benefit for the patients? Because in Gujarat, of course, the case was that as far as mental health is concerned, there were not enough psychiatrists who were available, not enough psychologists. There was not even a different department available. So do we have that kind of infrastructure in Karnataka?
In mental health, so far we are not taken into the PIP.
Okay.
We will take in future mental health, regarding the mental health.
Yeah.
But other activities which are being allocated, given or assigned for the Karnataka state, they are almost all we are implementing on the way. They are in good condition.
Okay, okay. We do hope that now, especially because of the pandemic and the lockdown, because there has been an increase on several people having, it having a mental effect on several people. We do hope that the Ayush Ministry will take note of that as well. Dr. Mohammad Rafi Hakim, many thanks for joining us with your inputs on that. So that is a report that had been filed by the CAG, and it spoke of a serious lack of initiatives that were to be taken, lack of infrastructure, as well as not enough focus on mental health. But of course, the doctors here clarifying that that's not the case in Karnataka. This was a report that had been filed on the situation in Gujarat, but things are very different here in Karnataka. But the bigger question of course, whether there is enough focus on mental health not being answered, that's something that has not been planned by Ayush Ministry yet. Now, with a lot of focus on mental health and ensuring, and because the numbers are also startling in terms of suicides increasing, especially after lockdown, it is time for the Ayush Ministry as well to take note of the same. Thank you so much for joining me on this video. Please let me know your thoughts as well in the comment section. I look forward to that. Thank you for watching. Take care.